Oh, shit.
I have another DVD to play.
We got 16 minutes left.
Cool. Many people suffer from an experience that can stay with them as long as they live. An experience that is false or distorted and appear to be real perceptions. The impressions are generated by mind and may be seen, heard, felt, even smelled or tasted. This is called hallucination. A 1996 report published in the British Journal of Psychiatry noted that 37% of 4,972 people surveyed experienced hypnagogic hallucinations, which are hallucinations that occur as a person is falling to sleep. Hypnopompic hallucinations are just upon waking, and they were reported by 12% of the sample. Hallucinations can happen to all of us. It can be caused by drugs, stress, exhaustion, meditation, mental illness, or disease, and it's good to know when it can occur. The three most common causes of hallucinations occur from drugs, schizophrenia, and hypnagogic hallucinations. I'm going to discuss these three types of hallucinations. The first type is drugs. The most common drugs that can trigger hallucinations are ecstasy, LSD, which is acid, mushrooms, and other drugs such as marijuana and PCP have hallucination effects. Certain prescription meds may also cause hallucinations. According to health services at Columbia, users of shrooms experience a sensation of being detached from their body and observing themselves, see brilliant arrangements of color and light, or see fantastical images before them. In larger doses, users may experience physical sensations such as numbness of the tongue, lips, and mouth, shivering or sweating, and anxiety. It can also change one's perception of time, making minutes feel like hours, using for the first time. According to HuffingtonPost.com, a girl named Frida from the UK said she took shrooms for the first time. The first hallucination was she was lifting up her hands and there was blood everywhere. She then went outside, walking down the street, trying to get to the garden, and saw wicked colors. She had a hallucination of seeing dead bodies in the road. And when she got to the house, she said there was no furniture and it looked like a carnival. And the garage felt like it was floating. Some hallucinations are pleasant and some unpleasant. Most of hallucination drugs are used in club scenes, such as nightclubs and raves, and are mostly used by college students. Drugs are not the only cause of hallucinations. Mental illnesses are also a cause of hallucinations. Up to 75% of schizophrenic patients admitted for treatment report hallucinations, according to the National Alliance for the Mentally Ill. Hearing voices that other people don't hear is the most common type of hallucination in schizophrenia. Voices may describe the patient's activities, carry on a conversation, warn them of impending dangers, or even issue orders for the individual. According to schizophrenia.com, hallucinations respond to a lessening of stress and an increase of antipsychotic medication. Out of the three most common hallucination cause would be hypnagogic. It's an episode of seeing and hearing things as one is falling asleep. These dreams can be frightening and can often cause a sudden jerk and arousal just before sleep onset, according to healthcares.net. One most common hallucination is the sensation of falling that occurs at the onset of sleep, which jerks your body and mostly wakes you up. That's like when you're like sleeping and do you ever feel like you're gonna fall off a cliff? Mm-hmm. And then you like jerk and you're like, oh my god. That's the most common. Overall, these causes of hallucinations can be very harmful to yourself and others, so be aware of the causes and effects.
That's interesting.